The cause of death was listed as drug overdose, but the medical examiner disagreed. The evidence was consistent with a toxicological profile indicative of substance abuse, yet it was also consistent with another condition, long QT syndrome. An exhaustive genetic autopsy revealed a pathogenic variant in the KCNQ1 gene, confirming the presence of this heritable cardiac arrhythmia. This discovery exonerated a family member who had been accused of foul play following the sudden death of a 28-year-old individual. Initial investigation was clouded by confirmation bias. Investigators dismissed the absence of drug paraphernalia due to the victim's history in a high-crime area, leading them to prematurely conclude substance abuse as the cause of death. However, a comprehensive re-examination of clinical and genetic data provided compelling evidence that long QT syndrome was the actual culprit behind this tragic event. Chapter: Case Background. The incident occurred in a residential neighborhood of Chicago on October 15th at approximately 23:45 local time. The initial report was made by a neighbor who noticed unusual activity around the deceased's residence and subsequently observed no signs of life upon entering through an open window. Upon arrival, emergency services noted a state of acute respiratory distress without visible injuries or external signs of trauma. Given the location within a known high-crime area, investigators assumed drug use based on preconceived notions and proceeded to collect evidence for what they presumed was an overdose. The absence of common drug paraphernalia did not alter their hypothesis, leading them to consider the possibility of foul play by family members present at the scene who exhibited signs of distress but no visible trauma. This set in motion a series of investigative steps that ultimately led to a genetic autopsy, which would reveal the true cause of death. Chapter: Initial findings upon arrival at the residence in question. First responders noted an unresponsive male lying supine on the living room floor without apparent external injuries. The scene lacked any evidence of a struggle or drug paraphernalia typically associated with substance abuse. Given the location's history of illicit activity, initial medical assessment by emergency personnel suspected intoxication due to environmental bias. Initial observations suggested signs consistent with acute overdose, including dilated pupils and respiratory distress necessitating immediate resuscitation efforts. Upon declaration of death at the scene, law enforcement classified the manner of death as undetermined pending further toxicological screening. However, the absence of paraphernalia and the sudden onset without preceding health issues prompted a broader forensic investigation into alternative causes for cardiac arrest, ultimately leading to an exhaustive genetic autopsy that would reveal crucial information about heritable conditions previously overlooked. Upon declaration of death at the scene, law enforcement classified the manner of death as undetermined pending further toxicological screening. This comprehensive approach shifted the investigative focus from criminal culpability towards medical pathology, setting the stage for a definitive exoneration based on genetic evidence. Chapter: Forensic investigation at the scene. Investigators collected various items for toxicological analysis, including personal effects, clothing, and bodily fluids from the deceased. Notable was the absence of drug paraphernalia or signs of injection sites, which initially led to skepticism regarding a drug overdose hypothesis. Present were several prescription medications consistent with those prescribed for cardiac conditions, but no illicit substances. The chain of custody meticulously documented each item's collection and transfer to the laboratory. Forensic pathologists noted an unusual lack of corneal edema or pinpoint pupils indicative of opioid use, further prompting genetic testing that revealed a KCNQ1 variant linked to long QT syndrome. This finding excluded drug overdose as the cause of death and implicated a heritable cardiac condition. Upon initial examination, toxicological screening was conducted to identify potential substances in the deceased's serum and urine, including opioids, benzodiazepines, cocaine metabolites, and ethanol. Confirmatory gas chromatography mass spectrometry GCMS, was employed for quantification of these compounds, with detection thresholds set at 0.5 ng/ml for most analytes. Cardiac tissue samples were subjected to histological examination, revealing no evidence of myocardial fibrosis or hypertrophy indicative of drug-induced cardiotoxicity. Microscopic analysis did not detect acute pulmonary edema or hemorrhage consistent with a lethal overdose scenario. Further genetic testing identified a pathogenic variant in the KCNQ1 gene associated with long QT syndrome, LQTS, explaining the arrhythmia observed at the time of death. This finding excluded drug toxicity as a cause, exonerating the accused family member and highlighting the importance of comprehensive genetic screening in forensic pathology. The initial investigation into the deceased's sudden death centered on the presence of several prescription medications in the home environment, despite the absence of drug paraphernalia or signs of recent use. Law enforcement pursued a hypothesis of fatal overdose due to the victim's history and location within a high-crime neighborhood. The postmortem interval was estimated based on insect activity observed at the scene, placing time of death approximately 12 hours prior to discovery. Forensic toxicology initially confirmed the presence of multiple psychoactive substances in the deceased system, but failed to establish lethal concentrations or signs of acute intoxication. Subsequent genetic testing revealed a pathogenic variant in the KCNQ1 gene, confirming long QT syndrome as the cause of death. This genetic autopsy exonerated family members suspected of involvement and highlighted confirmation bias among investigators who had disregarded alternative hypotheses due to environmental context. The timeline established through forensic evidence confirmed no signs of recent drug use or external trauma, aligning with a natural cardiac event rather than an overdose scenario. In this case, the initial suspicion of a drug overdose was based on circumstantial evidence and did not align with the comprehensive toxicology report, which showed no significant levels of commonly abused substances in the deceased system. The genetic autopsy revealed a KCNQ1 pathogenic variant indicating long QT syndrome, a condition known to cause sudden cardiac death. This finding excluded the possibility of an overdose as the cause of death. Dr. Emily Carter, a forensic cardiologist and expert in inherited arrhythmias, testified that the presence of this gene mutation provided conclusive evidence for a hereditary cardiac event rather than intoxication or foul play. Her testimony highlighted how genetic factors should be considered alongside traditional toxicology results to avoid misdiagnosis and wrongful accusations. The absence of drug paraphernalia was deemed irrelevant given the genetic predisposition identified, underscoring the importance of an interdisciplinary approach in forensic investigations. Chapter: Resolution upon reevaluation of the deceased's sudden death. A thorough genetic autopsy revealed a KCNQ1 pathogenic variant indicative of long QT syndrome, LQTS. This finding excluded any involvement of drugs and consequently exonerated the accused family member. Initial toxicology reports had suggested an overdose due to the absence of drug paraphernalia in the victim's home environment, which is typically associated with higher rates of substance abuse. The central evidence proving this genetic condition was a comprehensive genetic analysis conducted by a panel of experts specializing in cardiac genetics. Cardiologists and forensic pathologists collaborated to confirm that LQTS could lead to sudden death without apparent cause or drug involvement, especially if there were no prior symptoms or known history of arrhythmias. This shift from initial assessment to exoneration underscores the critical role of genetic testing in forensic investigations, particularly when dealing with cases where traditional toxicology screens suggest substance abuse. The absence of drug-related paraphernalia and a high-crime neighborhood environment led investigators to prematurely conclude drug use as the cause of death due to confirmation bias. Thus, this case highlights the importance of considering alternative medical explanations beyond surface-level observations in forensic pathology. This case underscores the necessity of comprehensive genetic testing in autopsies, particularly when drug overdose is suspected, but evidence is lacking. Confirmation bias can lead investigators to overlook alternative diagnoses. Genetic autopsy revealed long QT syndrome, exonerating a suspect and highlighting the need for rigorous scientific inquiry over assumptions. The file remains open.